This is the agent on patient's experience guidance agent. So here it monitors inpatient experience executions signals in real time and guides care team to early intervention that improve HCA-HPS outcomes before discharge. So patient experience scores are usually reviewed after discharging surveys are completed, but the real opportunity to improve experience happens earlier during care delivery, shift handoffs, and discharge preparation. So let us take the first use case, that is nurse responsiveness. So let us give the input for agent. Show current patient experience risk on this unit. So here the agent identifies patients where call light response takes exceed unit thresholds. Instead of waiting for dissatisfaction after discharge, staff are prompted immediately while care in still progress. So here you can see high experience risk is for E001, E007, E191, and for ICU high experience risk is 003, 009, and for orth unit high experience risk is E005, 195, 200. So here you can see responsiveness improves before patient experience gap becomes permanent. So let us take the second use case of this agent, that is discharge and shift handoff. Let's give the prompt as flag discharge action missing patient understanding confirmation. So here the agent detects discharge preparation without documented patient understanding. It blocks discharge completion and escalates the unresolved experience risk during shift handoff. So you can see discharge understanding gaps identified. So med search unit has three patients which are at risk, that is 1, 7 and 191, and ICU are of 2, 3 and 9, and ortho unit is of 3, 5, 195 and 200. So total encounters are flagged as 9. Risk type is missing confirmation of patient understanding at discharge. So communication gaps are corrected before the patient leaves the unit. So let us give the another prompt like show stable patient experience cases. So here the agent identifies encounters operating within expected responsiveness and communication standards and recommend continued monitoring. So you can see stable patient experience cases are of main criteria for this is call light response should be less than or equal to 8 minutes, no pending patient questions, discharge explanation documentation, and no open experience risk. So you can see E002, that is med surge and night shift, is stable patient experience because the call light is 3 minutes, patient questions is pending questions is 0, discharge documentation is already provided, and 004 also with similar with similarity. So here, this is not about improving survey scores after the fact. It's about improving execution during care delivery. When teams act earlier and more consistently, better patient experience becomes a natural outcome. So I can say HCA-HPS scores don't improve because surveys are reviewed faster. They improved because care teams intervene in earlier. This agent ensures that happens consistently. Thank you everyone.